But I guess I'll touch on the study that we did, I guess, throughout the presentation. But the name of the study was Social Determinants of Pharmacy Deserts in Los Angeles County, and it looked at the social determinants indicators that we find in the different service planning areas. And in South LA, when you compare it to, let's say, the neighboring spa, which is the West Spa, where there's more affluence, there was a striking difference in regards to how the social determinants of health were distributed. And those are regarding health insurance. It was regarding whether it was a healthcare professional shortage area, and really looked at like the number of pharmacies per 1,000 residents. And there was just definitely health disparities in that. But I'll go ahead and get started with the presentation. And all right, let's go here. Sorry. So we're going to be talking today about just adherence to medication regimen and lifestyle recommendations, and just looking at pharmacy services and care during the COVID-19 pandemic. Here. Trying to get to the next slide. So just some learning objectives for today. So we're going to discuss the definition of medication adherence, explain several general lifestyle recommendations that are generally given in primary care by providers to patients, which I like to think a lot of them could be non-pharmacological recommendations. Hopefully you'll be able to recall the importance of the adherence to medication regimens and lifestyle recommendations in the setting of COVID-19 pandemic. Apply some strategies to encourage adherence to medication regimens and lifestyle recommendations to older adult church parishioners, and recall medications that are used to treat COVID-19 patients in hospitalized and non-hospitalized settings. So first, we're just going to talk about medication adherence. So just to sum it up, the definition of medication adherence by the World Health Organization, WHO, is, adherence in general, not medication, but the extent to which a person's behavior corresponds with the agreed recommendations from a healthcare provider. And the main behaviors that fall under this include taking medication, following a diet, and executing lifestyle changes. So something we're all going to talk about today. And the World Health Organization says that it's agreed recommendations. And I caught the tail end of Pastor Rhonda's talk, I believe. And this is implying a partnership between the patient and the provider. Or in this instance, since this is a session or a module on how you can encourage your parishioners in regards to their lifestyle recommendations or their medication adherence, we're thinking about that partnership, putting you both on equal footing in regards to how behavior change, so to speak, works in that regard. So something that I've always kind of talk to my students about when I do talk about this in lecture, medication adherence is the extent to which patients take medication as prescribed by their healthcare providers. Oftentimes, I think in healthcare, we hear the term compliance. This term shouldn't necessarily be used because, like I said, there's that equal footing between you and whichever parishioner you're working with in regards to the medication adherence or adherence to their lifestyle recommendations. So medication adherence is the preferred term. It requires that active relationship, and it gives the the parishioner autonomy. So once again, you'll be working to encourage them. So needing to partner with them and seeking to understand them in regards to why they may or may not want to take a medication, and definitely connecting them to the right person who can talk to them about their concerns within their healthcare team. So why is medication adherence important? So this is something that it is simple yet powerful. As picture here is C. Everett Koop. He was the 13th Surgeon General under President Ronald Reagan, and he simply stated that drugs don't work in patients who don't take them. It's simple but powerful. So just thinking about medication itself is a problem of striking magnitude. So you have chronic illness medication adherence in developed countries averages at around 50%. In the United States, 51% of patients adhere to antihypertensive medication regimens. Anywhere from 33 to 69% of medication-related hospital admissions are due to poor adherence, and it costs more than 100 billion a year in avoidable hospitalizations. So poor adherence to medication accounts for that substantial worsening of disease, increased healthcare costs, and death in the United States. Just a continuance of this problem of striking magnitude. Patients with health plans with no copays have non-adherence rates of nearly 40%. So in a study where there were veterans who were being treated for high cholesterol, in which their copayment was increased, there were 3 groups that were compared: those who had copayment, some who had copayment, and those with full copayment. And it was found that those that had that copayment had non-adherence. So just, something important to think about the role of a pharmacist. Poor medication adherence in developing countries is also assumed to be even higher due to these assumptions of lack of healthcare resources and inequities in access to care. So this is a bit of an older slide, but there's a direct proportion from chronic disease increasing as time progresses. So this is just looking at disability adjusted life years, which is a health outcomes measure, looking at non-communicable, so the diseases that you can't necessarily contract, such as like your mental disorders, and some communicable diseases such as AIDS and TB combined over time. And you just see that there's a direct correlation between chronic disease increasing over time in regards to the United States, how much it's growing. So according to the World Health Organization, increasing effectiveness of adherence interventions may have far greater impact on the health of the population than any improvement in specific medical treatments. So if we can see here that chronic disease burden increases worldwide, medication adherence will further decrease. Then on the flip side, if we can get those under control, medication adherence could potentially increase. So we talked about adherence, but now looking specifically at non-adherence, it can be defined as the intentional or inadvertent failure to take medications as prescribed. It can have different types. So you're looking at not filling the prescription but never taking the medication. This is known as primary non-adherence. Filling the prescription but not taking the medication at all, missing doses, taking the wrong dose of the medication, taking it at the wrong time with the wrong special instructions, discontinuing it early, maybe due to cost, that's cost-related underuse of medications. So there's a lot of reasons there why we see medication non-adherence. So to change gears, and I like corny jokes, so this is just now to talk about lifestyle recommendations, what they are, objective 2 now. This little cartoon says weightlifting can help lower your cholesterol. Load up your fork with veggies and lift it up to your mouth. 3 sets of 15 reps a day. So now we're just going to be looking specifically at some lifestyle recommendations in regards to high cholesterol, high blood pressure, diabetes. Well, high blood pressure, high cholesterol, and heart disease, but however, these undoubtedly will help with prediabetes, diabetes, loss, and arthritis pain, as well as heartburn in some cases, which are common chronic diseases we're seeing within the community, and especially in older adults. So this is just, you may have seen this already, maybe from Dr. Kibe in the last couple of sessions, but this is just looking at some of those therapeutic lifestyle recommendations and changes, which I like to call that it's medicine, but it's almost like medicine for life. It doesn't require any kind of pharmaceutical, but just thinking about the older parishioners who may have some of these chronic conditions that have to do with heart disease, high cholesterol, just thinking about changing that diet. So this is just breaking down how much, what the recommended intake is to lower cholesterol and maintain a healthy diet. So not necessarily having to memorize this, but this is here as a resource for you, just saying, you know, when you think about nutrition, what should be done in addition to any medications that they may be taking, whether it's fish oil or some type of statin for their cholesterol. So this is just looking at the types of fats and what the intake should be, the types of carbohydrates and the intakes and protein. So all of those major macromolecules are important for our health. So I won't belabor the point, but it's there for you, and I'll provide these slides later so that you can have it when you are working with different parishioners within the church community. So, but this is what I want to drive home in regards to the points from that particular image that was just shown, recommendation for foods with fats. So just thinking about the good fats and the fats that we don't want. So polyunsaturated fats are the ones that preferred. So when you're looking at the nutrition label, lifestyle recommendations, these are the types of fats that reduce that bad cholesterol and other fats, and they are associated with a reduced risk of heart disease. So you want more of these. The ones that are highlighted should be limited because they increase that bad cholesterol and other fats in the body, and they're associated with an increased risk of heart disease. So these are saturated fats and those trans fats. And then the monounsaturated fats, which would be on the label, if it's broken down on the types of food, would also reduce the bad cholesterol and may also increase that good cholesterol that you hear about you go to the doctor's office. So this is just an image trying to drive that point home again, thinking about the fats. So this is just a sample of a label showing you which should be limited and what you should get enough of in regards to other nutrients that are out there in vitamins, and having the pictures there for you. So the saturated fats are including your meats, dairy, coconut oil, trans fats. We love these. These are the ones that taste good, but they're not good for us. And polyunsaturated. So if you see people might be taking omega-3, that's a type of polyunsaturated fat. You can get it from the diet, as in fish, but you can also get it as a supplement that you can buy at the pharmacy, but it's in fish, nuts, beans, and seeds. And then monounsaturated, which is also good, as it said on the previous slide. Those are some that are in some nuts, olives, avocados. So those good fats versus the bad fats. And then of course with fiber, also important, you have two types, both are good for you, whether they're soluble or insoluble. And this is just a list of showing what types are in each, but both of them are good. They help with digestion. They can help lower blood sugar. And then the soluble fats can also help with lowering cholesterol as well, the bad cholesterol. So definitely good things for intake. And then of course, when you're thinking about somebody that has diabetes, thinking about the strawberries and blueberries, just making sure they're watching the intake because there's still sugar in it. Even though it's good sugar, it's more sugar that's better for the body, it still will cause the blood sugar to rise. So just doing that, making sure that there's not as much intake of that and it's balanced. And then just thinking of lifestyle changes again that affect bad cholesterol. You always hear us talking about weight loss. So what it does to the bad cholesterol, it's variable what weight loss can do to bad cholesterol, but if there's that low saturated fat diet, it can drop that bad cholesterol anywhere from 12 to 15%. And the fiber can also drop the bad cholesterol anywhere from 10 to 15%. So in regards to blood pressure, which is something that's very prevalent within the community, the African-American community and older adults, these are just some of the lifestyle recommendations for prevention and treatment of high blood pressure. Not necessarily saying you should don't take your blood pressure medication, but in addition to the blood pressure medication, as things get better in the pandemic, that weight loss, being able to, walk around, do some exercising, this is just looking at the different blood pressure. So even for those who have high blood pressure, using these types of these recommendations for lifestyle can lower that top number, which is the most important number for the blood pressure in regards to heart disease and heart attacks and strokes that can come from that. You're looking at these different recommendations here in regards to the healthy diet, which is called a DASH diet. sodium that you take, so that's salt, and then the potassium. So we want more potassium within the diet. So looking at foods that include bananas, some cantaloupes. So a lot of foods like that, sweet potatoes, prunes. They're very good for the blood pressure on top of the blood pressure medications that a patient might be taking. So these lifestyle recommendations always go hand in hand with the medications that a patient or a parishioner might be taking. So these are just listed here for you for some ideas to know what should be done and what should be adhered to and maintained for health. This is, again, looking at the DASH diet. So that's dietary approaches to stopping hypertension. And it just lists here the different types of food, what types of serving should be in there. Similar to what some people may know as like looking at that My Plate method. This kind of gives an outline of what types of food should be eaten and the servings per day. And then this is just breaking down physical activity and alcohol consumption, what should be done, and then how it affects the blood pressure in regards to reduction. So I liked jokes. So this is just like corny jokes. I don't always exercise, but when I do, I expect the results to be instant, dramatic, and spectacular. So I know that's something that sometimes when people start a diet program and along with their medications, along with the physician that they're working with, this is just for fun, but in all seriousness, to be the church parishioner's cheerleader and advocate. And it takes time and consistency and discipline to maintain that healthy habit. So just being in their corner in this regard, especially considering this pandemic, because we're now going to talk about why it's so important to maintain adherence to medications and to the lifestyle recommendations that are set forth by healthcare providers. So why is this important? And I know I feel like I've talked about this slide a lot in the last couple of months, but it's very important because this brings it home to the communities that we live in and where I know I serve patients in clinical pharmacy. We've all heard of the racial and ethnic disparities in COVID-19 infections and hospitalizations and deaths. It has hit Black, Latinx, and American Indian and Alaskan Native communities the hardest. So you're seeing infection rates that are upwards of 2 times more than non-Hispanic whites, hospitalization rates that are anywhere from 3 to 4 times more than whites, and death rates that are 2.5 times more than whites. So it's very important about maintaining that health because as we can see here, looking in LA County to bring it home, even closer to home, we have, as highlighted here, African American and other minorities and those who have higher poverty, as we see where it says area poverty. Something that we definitely see a lot of in South Central LA are exposed to get sick or hospitalized and die at higher rates than their white counterparts. Also, as we know, African Americans have higher rates of chronic illness, which requires more care. So this can affect medication use behavior, especially in the setting of the restrictions and lockdown we've had with the pandemic. So just looking at a little bit more data, why is it important to maintain that adherence? Furthermore, as we see from this slide, Los Angeles County racially and ethnically minoritized communities, such as those in Spot 6, fare worse than predominantly white communities, such as in Spot 5, in the percentage of adults that have diagnosed diabetes, age-adjusted diabetes death rates, and adjusted coronary heart disease rates. So with the rates right here for Spot 6 being highlighted in yellow. So the most important part would be this part right here. Why is it important, again, to maintain that adherence, both to medications and lifestyle recommendations? You have, when you put all of this together, you have persons listed here who are in these groups that are patients that are high risk for severe COVID-19. Those who are elderly, have pre-existing conditions such as cancer, chronic kidney disease, COPD, if they have any autoimmune disease, diabetes, severe obesity. These are all people who will have high risk of severe COVID, which we don't necessarily want because that's what causes someone to be hospitalized. So your church parishioners will likely fall into at least one of these groups, which have been hard hit by the COVID-19 pandemic, whether it's age because they're elderly, or the race, which there's structural inequity and racism that's leading to these place-based disadvantage and inequitable distribution of the social determinants of health, which was something we found in our study because a lot of it was place-based when you looked at the different service planning areas, or if they have a chronic condition status, where there's 1, 2, 3, 4 chronic conditions, also that stem out of not family history and biology, but also that structural equity and racism that leads to this place-based disadvantage. So just thinking about strategies now of how can you encourage adherence, whether it's in medications or lifestyle recommendations. So in regards to medication adherence in older adult church parishioners, it's important to encourage them to know their full medication list, that regimen. And so knowing the type of medications that they're taking, whether the medication is a prescription medication, over-the-counter medication that they can purchase, what the dose is, what the form is. It a tablet? Is it a capsule? Is it something that they have to, a powder? Knowing what that is and the directions of how it's supposed to be taken in, especially what it's for. There's so many patients that I see come in who don't necessarily know what the medication's for and take it just because it was given to them. So it's very important for them to know what these medications are for. And that's where it becomes very important to be working with a pharmacist, whether it's in a community pharmacy setting or it's a pharmacist that's at their clinic. A lot of times you can call the community pharmacy where you get your medications and just talk to the pharmacist about what all of the medications are for, or if they have time, schedule an appointment for them to go in and learn about what that medication is for and get that medication list. And this can also be done if there's a pharmacist on staff at the clinics that some of the parishioners go to. Keeping up with refilling medications, which is very important. Making sure that the pharmacy that they use, they have that contact to be able to get those refills done. If there are services within the pharmacy that are provided that they can kind of sync their medications up so that they're all dispensed at the same time, signing up for those types of programs can be very helpful. Making sure that they're always keeping up with appointments with their primary care providers, because I know some of my colleagues will hold on to patients' prescriptions to make sure they come into the office so that they can be seen because they won't be seen otherwise. So making sure they're keeping up with their appointments so that they can get their refills. And then even with the specialists too. So those who may be seeing endocrinologists, who may be seeing cardiologists or nephrologists for different diseases, making sure they're keeping up with those medications and knowing who they're getting what from. So that means looking at that medication list and writing down everything. So not only the type, the dose, the dosage form, directions and indications, but also who provides this medication for me. So I know who to call when I'm out of it, or I have a question about it, or I can talk to my pharmacist about it if I can't reach my provider. Assisting them with technology or transportation needs. So especially now as the pandemic is letting up, we move from purple to red tier and more people are going out and you're seeing them in the highway, in the streets and things, making sure that those who want to go into their pharmacy and maybe didn't switch over to mail order or something like that can get to the pharmacy to get those medications, or the technology needed to sign up for mail order if they don't feel comfortable. So just being there in that regard. And then always encouraging them to ask questions about their medications if they're not sure, because knowledge is indeed empowerment. So I know some people complain, the pharmacy I go to is very busy, the pharmacist never wants to talk, but it's your body, it's your health, and you should push for that. And if that's something, I know I tell my patients, if you can't get that, then it may be beneficial to look for services elsewhere where you can have someone that you trust that you can talk to about those medications if you can't reach the pharmacist, or to reach your primary care provider. Finding another pharmacy that maybe has, services that are better for you and someone that you can speak to, because there is something known as transferring medications from one pharmacy to another to receive better service, because the knowledge is very important to have about what you're taking. And also this is important for caregivers as well. So if you have a parishioner who may not be completely in the mental state of mind, might have dementia or some kind of cognitive difficulties, it's important for caregivers to know this as well. So just thinking about the role of the pharmacist in here, this whole, what I just talked about. So you have pharmacists emerging as these medication experts in the team when you think about patient-centered care. So, and patient-centered care being defined as care that's respectful, responsive to the individual patients, their preferences, their needs and values, and ensuring that this patient's values are at the center and guide all of the clinical decision. So this requires a true approach between individuals and their healthcare providers. And as you being a health advocate, you're joining that team so that the individual's needs and aspirations are thought about, they're acknowledged, and they're considered, and helps improve patient outcomes. The pharmacist is particularly important because we're working with all of the healthcare providers. So you may even need to work with the pharmacist that your parishioner has, to talk to them, to kind of be their advocate if there's something there that they're not able to reach or to understand. So working with that pharmacist who has the knowledge in regards to medication access, if there are insurance issues or physical access issues, medication reconciliation. So when you have parishioners who may be coming in and out of the hospital and moving to another level of care in the community, there are always medications that you're on in the hospital that sometimes fall through the cracks, and it ends up making all of the medications that someone may be taking more complex than it actually is because no one sat down to actually go through them. So that's where the pharmacist is important. So exactly thinking about those parishioners who may be coming in and out of the hospital, what's going on with their medications there. Comprehensive medication management, something that we do, just an overall comprehensive review to optimize the medications. What should they be on in regards to appropriateness? Is there a level of deprescribing that needs to happen? Looking at any medication errors, adverse drug events, drug interactions between the medications they're taking, new medications they may be on, or even some foods. Medication non-adherence. Some pharmacists definitely working in that realm in regards to chronic conditions, in regards to keeping blood sugar on target, blood pressure on target, and other values such as the cholesterol. And then just always bringing that piece of the patient's lifestyle, social factors into their into everything that contributes to their health. And then services provided include some of the, like I said, those targeted medication reviews, looking at those complex disease states such as diabetes, HIV, COPD, or what have you. But altogether, you're being a part of the team now as an advocate within the religious community to improve the health outcomes for the patient. So just thinking about pharmacy services. So what's out there in regards to encouraging, again, parishioners about medication adherence. So a lot of it is about knowing what the pharmacist can do and what pharmacies actually do. So we just briefly talked about comprehensive medication management. Sometimes this can be done in the community pharmacy, and sometimes there are community pharmacies that have partnerships with private medical clinics, or even sometimes in federally qualified healthcare centers. I know that's something I'm trying to build out of the site that I'm in, to connect with the pharmacists that are at the pharmacies that my patients are going to be able to have that that connection of care in regards to pharmaceutical care. Pharmacies, as we all know and we've heard, and this is a big topic I've been talking a lot about, is pharmacies and immunizations. So especially considering the community where we have a lot more, I guess when you think about residents per square mile and less pharmacies to serve the area, thinking about immunizations, how would they get not only the COVID-19 vaccine at pharmacies, but then also other vaccines such as flu or any routine vaccinations that may be needed, like the tetanus every 10 years, or if they need hepatitis B or pneumonia vaccine. So these are things that are offered in pharmacies and in the clinics, of course. medication delivery. So pharmacies do that. I know that's another research area that we want to look into, especially to see what kind of services are being provided in these particular pharmacy deserts that we were able to identify. Any pill box packing and pill packing, whether there's for people who may have a lot of medications that they're taking and they can't remember because of cognitive issues. Sometimes it's easy to bubble pack or put it in a pill dispenser, so it's easy to just open and use. So these are services that can be at a pharmacy, or even within the patient's clinic that they go to, they can be connected with. I know there are some pharmacies in South LA that will bubble pack and send the medications, especially to some of the HIV patients that we see who take several medications, and they can provide it for other patients as well who may be having a high pill burden. Drug information, just in general, if you have questions or if the parishioner has questions about drug information, we provide a lot of patient education. What is this drug for? What are the side effects that may be coming from it? How are you supposed to take it? Even down to insurance, like what programs are available for you to, be able to afford the medication. In addition to that, pharmacies in the state of California have been approved through the Pharmacy Practice Act to provide tobacco cessation consultations. So thinking about those lifestyle recommendations, and one of them for cardiovascular health, heart health, quitting smoking if you do smoke, because smoking will increase your chance of having different types of cancers, lung cancer, and cardiovascular disease, and stroke, and heart attacks. And then pharmacies can provide what is known as HIV PrEP and PEP. So that's pre-exposure prophylaxis and post-exposure prophylaxis. I'm not going to go into much about that, but there's also contraception consultations, not necessarily, hopefully not needed for the older parishioners, and travelers' health consultations. So, so these are services that just complete lists of what's being provided, especially in the state of California, based on our Pharmacy Practice Act. I'm sorry, I'm having trouble advancing to the next slide. Okay. And then I bring this slide up again. We just saw it, but I show the slide again because if you are any of the, if the parishioners have any of these conditions, the data has shown that these particular populations are likely to develop severe life-threatening illness or death from COVID-19. Acquiring COVID-19 will limit these individuals' ability to receive ongoing care, vital to their well-being and survival. So providing adequate and timely COVID care, whether it's in the form of prevention and the vaccine, or it's through just, being able to get them to the hospital when there's symptoms, it's going to be very important. And but in these groups, it can be particularly challenging because of this, the level of comorbidity. So that's why I cannot stress enough that taking all the medications is so key, keeping up with appointments and maintaining health, and keeping those underlying chronic conditions under control, because these medications are chronic and you have to be on them and take them as prescribed every day for a very long time. So just changing it to overall just health recommendations, similar to things with the pharmacy, keeping up with those annual wellness visits and checks, and screening. So annual wellness visit, whether it's going to be colon cancer screenings, mammograms, and other screenings that are recommended, keeping up with those and assisting with technology for those things to happen, especially now that there's telehealth. And some of the screenings can be questionnaires, but some of them you have to go in and actually physically get. Chronic condition visits that are with specialists, keeping up with those too. Know that we notice an uptake in diabetes going out of control a lot because people weren't able to get into the clinic. And I know a lot of clinics are now trying to put together, or have been for the last year, telehealth. They're being paid now for these telehealth types of visits and things. So they are available. And if it can't be done through a video chat because maybe someone that is older either doesn't have access to internet or it doesn't work very well, there are telephone visits as well. And I know some clinics do provide transportation needs if it's needed. Be knowledgeable about their health conditions and allergies, very important. And especially with allergies in regards to the vaccine, but I'll talk about that a little bit more later. And then always asking questions about health-related issues. Once again, an informed patient is an empowered patient. So if they don't know, trying to learn more about their health conditions and allergies, what they're taking and what each medication is for is important. So finally, we're just going to talk about COVID medications. Just going to be a very brief overview because some of the names of the medications I'm not expecting you to remember, but this is here as a resource for you when you have questions. You can always reach out to me. My email will be provided at the end of this presentation. So COVID-19 medications and treatment. How can you, as advisors, help? So this is just thinking about the coronavirus treatment acceleration program that exists out there through the FDA. This dashboard just provides a snapshot of the development of those potential COVID-19 therapeutics. These numbers are changing frequently, of course, because of the moving target that the pandemic has become. And these numbers don't include the vaccines. And we only still have one medication that has been approved by the FDA in use in COVID-19. It's remdesivir. It's approved for COVID-19 in hospitalized patients. So there has yet to be anything that has been approved for patients who are not hospitalized. It reduces the time to recovery and is approved in children 12 years and older. But there are a lot, as we see here in the pipeline, and 9 now that are used for emergency use authorization. So that's just what's out there. If you're asked about what medications are approved, there's only one that's actually approved to treat, and that's for people who are hospitalized. So just thinking about the hospitalized patient very briefly, there are different groups of drugs, not expecting you to remember these, but you have sometimes when patients go in, they're being treated for possible flu because flu and COVID and even sometimes some pneumonias can present looking similarly. So they'll be on a lot of these different types of meds that are listed here, but then they're also being put on medications to prevent blood clots because COVID-19 makes you in a state where your blood clots a little faster and can increase your risk for strokes and heart attacks. So they may be on that. They will be on fever reducers that we know, Tylenol, some of the NSAIDs. And then the considerations is that they stay on their home medications that they're on. So going back to that primary care and chronic conditions, the blood pressure medications, the statins for cholesterol, if they have asthma or COPD, being on their inhalers, and then immunosuppressants if they have some type of autoimmune disease. So these are just the associated medications in the hospital. And then as they're being discharged, we're looking at, and I put pharmacotherapy. Pharmacotherapy is the same thing as medications for transitions of care. So moving from out of the hospital into back into the community. Patients are not being discharged with a lot of opioids, not trying to contribute to that already epidemic, and a lot of steroids, but other medications that are manageable and that are affordable. You can buy Tylenol and you can buy ibuprofen over the counter for pain and fever. And then, like I said, because COVID-19 increases your body's ability to clot, you will see them being on medications that are blood thinners, such as aspirin or other blood thinner medications, and then also inhalers too for breathing. And then finally, just thinking about those who may have COVID, who are just treating themselves at home, there is that emergency use authorization for some medications now that are in clinical trials. They're looking at them as antibodies for patients with high risk of progressing to severe COVID-19. So that group of that I mentioned earlier, those who have diabetes, who may have chronic kidney disease, all of those patients who have diseases that would increase their risk for severe COVID-19. There are clinical trials for that. If interested, a parishioner can talk to their healthcare provider about how to enroll in one of those trials if they feel like it would be good to, in addition, maybe have the vaccine and then also maybe use these antibodies to see how well they protect in preventing COVID. And then just in general, staying at home, supportive care, It might be Tylenol, which you can purchase over the counter, NSAIDs such as Aleve or ibuprofen over the counter, cough medicine, the dextromethorphan that can be found in Dimetapp or just by itself as a generic is over the counter. There are some other prescription medications, such as these pearls known as Tessalum pearls or benzonatate that you can get to help with the coughing. And once again, so important, continue all medications as prescribed unless otherwise stated. If you have a parishioner who may be having some issues with eating, they may work with their doctor to adjust their insulin for that time, because we don't necessarily want their blood sugar to drop because they're not eating and then they're also taking insulin. So that's something they can work with their doctor about. Avoiding that nebulizer use if it's something that someone uses in that underlying asthma or COPD, because it would definitely spray out those particles with COVID. So not using that in the home. And then they should always speak to their healthcare provider about any temporary discontinuation of immune system modulated medications so that it doesn't necessarily worsen disease, because the immune system is kind of blunted out for a while. And then I know there's been a lot of people talking about COVID-19 and vitamin supplementation. There's not a lot of evidence out there as to whether these are going to prevent or treat COVID-19. There's nothing wrong with taking these types of supplements just for overall health maintenance, but they're not something that anyone should be using to treat their COVID-19. While there are some trials that are few and far in between going on out there, there's no strong evidence for this. So if you're taking something like this, or someone wants to take something like this, definitely talk to their doctor about it, or the pharmacist, or both. And it's nothing wrong with it in regards to it being something as a supplement for health maintenance, but other medications can interact, especially with vitamin K if you're taking warfarin. So that's something to be on the lookout for. But of course, with vitamin C, people take vitamin C for the flu season, they take it for cold. So it's definitely good for health maintenance. Vitamin D, in my own just anecdotal, just seeing around the community, a lot of people have low vitamin D, so they can take supplementation or they can just get it from out of the foods that they eat. So closing in that loop again about lifestyle recommendations, a lot of those healthy foods that we talked about are high in all of these different types of vitamins. And these are just looking at the recommendations for what the the daily intake should be based on the age. And then just something I know that I talked about before, the vaccines and the medication. So with the COVID-19, there's nothing known in regards to a specific medication that will interact with the vaccine. Note that those who have been taking the vaccine, prior to getting the vaccine, they're asked not to take over-the-counter medications such as Tylenol, Advil, or Motrin. You can most certainly take it afterwards if you're having some arm pain, but they're asked not to take it beforehand, before going in to prevent that arm pain, because they want to know if there's any type of reaction that won't be attributed to these potential medications. The influenza vaccine, of course, interacts with these medications, and vaccines in general, you want to speak to your doctor if you're taking any medications that decrease your immune response. And then just really thinking about the vaccine again and medications in history, which a patient should know. This is just looking at the nationwide monitoring that was done in regards to people who received Pfizer vaccine, anywhere from December all the way the middle of December to the end of December. And they found that there were 21 cases of anaphylaxis being that severe, potentially life-threatening allergic reaction. 71% of these 21 cases occurred within 15 minutes of the first dose of the vaccine. 81% of the 21 people that had anaphylaxis had that past medical history of allergic reactions to medications, foods, animals, and the environment, even some other vaccines. So the key take-home point here for you to know and to have in mind when encouraging parishioners in regards to the vaccine, medication adherence, and lifestyle recommendations is that they should know their medical history regarding their allergies. Talk with the primary care provider about the risks and benefits, of course, of getting vaccinated, and follow the guidelines that are set out when you do go to the vaccination site, whether it's the clinic, whether it's a mass vaccination site or a pharmacy. If they tell you to sit for 15 minutes, sit for 15 minutes after you've taken the vaccine. If you have a history of allergy and they say sit for 30 minutes, because they're definitely doing their due diligence and making sure that nothing happens, because especially with the mRNA vaccines, while they're not new in regards to the technology, these are the first ones that are, being used in mass groups of people, but it's about 10 years old, the technology itself. And this one is just looking at Moderna. So within the Moderna vaccine, through that nationwide monitoring, again, there were 10 cases of anaphylaxis that were detected out of 4 million doses that were delivered between the 21st of December all the way to like the 10th of January, 15 minutes. And 9 of those people had, again, a past medical history of allergic reactions, medications, foods, and environment. So once again, those take-home points, just make sure you know your allergies, your medication and your medical history, and just make sure you're following those recommendations that are set out when you go get the vaccine. Did my screen just change to something else? Oh, I see what happened here. It actually clicked on and opened it up. So let's see. Where are we? So yeah, that pretty much completes the presentation. And these are the learning objectives. Again, we talked about medication adherence, lifestyle recommendations, the importance of that adherence, especially in the setting of the COVID-19 pandemic, and then just talked about some strategies to encourage that adherence to medications and lifestyle recommendations. And then we went through some of the medications that are being used to treat patients in the hospital and non-hospitalized settings for COVID-19. So I'll just open up the floor for questions.
Thank you so much, Dr. Wisseh. This was very informative, very needed, and I think it captured a lot. It brought in a lot, especially with not only vaccinations, but of vitamins, of just what we need to do in terms of our diet,